When comparing different Medicare supplement plans, Plan G versus Plan N is often the conversation that dominates social media and the headlines. Today, instead of rehashing this usual debate, we are going to take a deeper look at a different Medigap plan, which both consumers and even brokers often overlook.
How the heck did I miss that?
In fact, when you look at the chart from the official Medicare and You handbook, it's not even obvious that this plan exists unless you pay attention closely to the notes below the chart. In case you haven't guessed by now, the plan we're going to cover in today's video is the High-Deductible Plan G. We will talk about how the High-Deductible Plan G works, who it might be right for, and we will look at the long-term financial impacts of enrolling in this plan and what that might mean for you. First, my name is Cameron Giardini, and I help operate our family-run independent insurance agency, Giardini Medicare. If you want to work with us or another broker we trust, you can do so by going to our website, gmedicareteam.com. There you can click the Schedule a Free Call button. Otherwise, all we ask is that if you find this video helpful, that you give it a like and you subscribe to our channel for more videos in the future. First, there are two versions of the High-Deductible Medigap plans. These are the High-Deductible Plan G, which we mentioned, and the High-Deductible Plan F. However, it is important to note that the High-Deductible Plan F, or referred to as the HDF, is no longer available for individuals who first became eligible for Medicare on or after January 1st, 2020. So for this reason, our focus in today's video will only be on the High-Deductible Plan G, also known as the HDG. This remains a viable option for those seeking an alternative approach to Medigap coverage, and despite the difference in eligibility, both the High-Deductible Plan G and the High-Deductible Plan F, they do function virtually identically, offering very similar coverage structures and cost-sharing mechanisms. It's important to remember that when we discuss different Medigap plan letters, whether it's the high-deductible plans or not, that all of these plan options, they share some of the main benefits of enrolling in a Medigap plan. These benefits, they include the freedom to see medical providers nationwide who accept original Medicare, giving you more flexibility when you're trying to decide where to get treatment. Additionally, prior authorization for medical procedures is extremely rare with Medigap plans, providing you with greater ease and access to necessary medical treatments. So, how does the High-Deductible Plan G work compared to the so-called traditional or the regular Plan G? Well, first, the traditional Plan G is well known for its comprehensive coverage, covering all Medicare-approved expenses except for the Medicare Part B deductible. Currently, in 2024, the Part B deductible is $240 for the calendar year. Now, contrast this with the High-Deductible Plan G, which, unsurprisingly, has a much higher deductible of $2,800 for 2024. This substantial difference in deductibles means that with the High-Deductible Plan G, you will need to pay more out of pocket before your Medigap policy starts paying for covered services. One of the most important things about the current $2,800 deductible is that it is not static. As written into the Social Security Act, this deductible amount, it can and it typically does change on a yearly basis based on the Consumer Price Index for all urban consumers, which could be shortened to the CPIU. According to Investopedia, this index, it measures changes in U.S. consumer prices based on a representative basket of goods and services. The deductible amount is typically announced in October based on the CPIU calculations from a 12-month period ending in August. The new deductible amount is then applied beginning January 1st of the following year. So, for example, from 2022 to 2023, the CPIU, it increased by 3.67%. Then applying that percentage increase to the high deductible amount from 2023, which was $2,700, this results in an increase of approximately $100, bringing the 2024 deductible up to $2,800. And again, this deductible amount, it runs for the calendar year, which is January 1st through December 31st. And with recent increases in inflation, it's really not surprising that this deductible amount has increased faster in recent years compared to normal. And we will discuss these details of increases in more detail shortly. If you want to see for yourself the historical changes to the high deductible amounts over time, you can use this source directly from Medicare, which we will link to, of course, in the description below this video. In addition to understanding how the deductible changes over time, it is equally crucial to understand that the deductible for the high deductible Plan G does not work the same as a typical deductible that you might be used to. Typically, a deductible for health insurance is defined as the amount you pay for covered healthcare services before your insurance plan starts to pay. For example, using this definition, if your health insurance has a $3,000 deductible, and then after that it covers 50% of cost once you've paid that full deductible, if you were to get a $5,000 bill, you would pay 100% of the first $3,000 out of your pocket, and then the insurance company would split the remaining $2,000 50-50 between you and them. This would result in you paying $4,000 out of pocket and the insurance company paying $1,000. Now, fortunately, this is not how coverage works with the high deductible Plan G.
Well, how does it work?
Although it's true that in 2024, you would have to spend $2,800 out of pocket before your high deductible Plan G policy kicks in, even before this happens, you still benefit from having the coverage of Original Medicare Part A and Part B. This means that instead of paying 100% of costs up to the $2,800 deductible amount, instead, you would be responsible for paying the out-of-pocket cost-sharing amounts that you can see here on the screen for Part A and Part B covered services until you have paid enough to reach that high deductible limit for the year. Just remember that these cost-sharing amounts, they can and they will change over time. Essentially, the high-deductible version of the Plan G, it works like having Original Medicare with a maximum out-of-pocket or financial cap on your spending for Medicare-covered services. This will make more sense with an example comparing the out-of-pocket cost with a traditional Plan G versus the high-deductible version. Using 2024 numbers, suppose at the beginning of the year you visit a doctor's office and you have non-preventive procedures with a total cost of $3,000. These costs are then adjusted down to the actual Medicare approved amount of $1,000 in this scenario. Now, because these services were done at the doctor's office, they would almost certainly fall under Part B of Medicare. Therefore, with the original Plan G, you would have to pay the full $240 Part B deductible as your out-of-pocket cost. Then, your Medigap plan, in this case the Plan G, would cover the remaining costs, leaving you again with that bill of $240 in total. Compare this to the coverage with the high deductible G, where you would still have to pay 100% of the Medicare approved costs to again meet that Part B deductible, which means you would have to pay the first $240 out of pocket, which would count towards that $2,800 deductible. But instead of your Medigap plan then picking up the remainder of the cost, you would be responsible for the original Medicare cost sharing amounts. In this case, of the remaining $760, Medicare Part B would cover 80% of these remaining costs, and you would be responsible for the remaining 20% of the $760, which in this case is $152. After these services are said and done, you will have paid a combined $392 out of pocket, which leaves $2,408 remaining from your original $2,800 deductible. Original Medicare will have paid $608, and your Medigap plan will have paid $0 in this case. Now we compare this again to the traditional Plan G. In that case, you would have paid $240. Medicare will still have paid $608, but in this case, your Medigap plan will have paid $152. Let's continue with one more example comparing the regular Plan G versus the high deductible Plan G. This time, let's look at what happens if you receive services covered under Part A of Medicare. We will keep this simple, but let's say after your doctor's office visit from our previous example, you are hospitalized as an inpatient for a few days, and then you're released to go home. In this case, you would likely be responsible for paying the Part A deductible, which is currently $1,632 per benefit period. With the traditional Plan G, your Medigap plan would pay the full $1,632 for you. However, with the high deductible Plan G, since you still have $2,408 of your deductible remaining, you would have to pay the full $1,632 Part A deductible out of your own pocket. After all this brings the amount that you have paid towards your high deductible for the year to $1,632 plus the previous $392 for a total of $2,024. This leaves you with $776 remaining towards that high deductible limit. Just for curiosity's sake, what amount of total Part B approved costs would it actually take for you to reach your full $2,800 deductible? Well, in 2024, to reach that $2,800 deductible with only Part B covered services, the total Medicare approved cost, they would have to reach all the way up to $13,040 for you to actually reach the full $2,800 deductible. This would include paying the $240 Part B deductible and the remaining 20% up to the $2,800. Finally, keep in mind that preventive services, they are still covered at no cost to you, even if you have the high-deductible Plan G. For example, if you go in for your yearly wellness visit and you have nothing else done, Medicare should cover this service 100% as a preventive service, leaving you with no out-of-pocket cost despite not having met your $2,800 deductible. After seeing these out-of-pocket examples, you could be wondering, well, why would anyone want the high-deductible Plan G? When choosing a Medigap plan, one of the most significant factors to consider is the cost of the monthly premiums, which will vary from one plan letter to another. Unsurprisingly, the high-deductible Plan G, it offers substantial premium savings compared to the traditional Plan G and even compared to the Plan N. To illustrate this, let's take a look at the average premiums for some of these plans in several states, including Michigan, Texas, Florida, and New York. To find how these average premiums compare in the different states, we looked at the 5 companies offering the lowest cost Medigap plans for each of these different plan letters in each of these markets, at least as of summer 2024. We also looked at the premium rates for men and women, both at age 65, to get a better idea of the average cost for each of these plan letters. You can see the different average premiums for the Plan G, the Plan N, and the high-deductible G that we found right here on the screen. As you can see, in each state, the monthly premiums for the high-deductible G are lower than Plan G or Plan N. Again, this is not surprising due to the higher risk of out-of-pocket costs associated with that plan. However, you can also see that the premium savings will vary greatly based on the state that you live in. For example, in Texas and Michigan, the high-deductible Plan G is roughly $50 per month less than Plan N and $80 less than Plan G. Compare this to Florida, where the Plan N is roughly $80 more per month on average compared to the high-deductible Plan G, and Plan G is approximately $130 per month higher compared to its high-deductible counterpart. This difference is even more drastic in New York, where Plan N premiums could be over $150 per month higher compared to the high-deductible Plan G, and Plan G being over $200 per month higher compared to the high-deductible G premiums. Now that we have looked at how the high-deductible G works compared to the traditional Plan G and have seen how the monthly premiums for each of these different plan letters will vary, let's look at how these different Medigap plans compare when we combine the long-term projections of both premiums and out-of-pocket costs and their increases. As we typically mention in our videos, when considering which Medigap plan might be right for you, it is essential to consider long-term costs and not just short-term costs and premium savings. Remember, in most states and in most circumstances, if you want to change from one Medigap plan to another, you will have to qualify for a new Medigap plan based on your health and pre-existing conditions. And your enrollment into that new plan, it could be denied. To learn more about that exact underwriting process for changing Medigap plans, just make sure to watch this video next. Even in states that do have unique guaranteed issue opportunities, such as birthday or anniversary rules, these opportunities, they might allow you to change from a Plan G to a Plan G, or from a Plan N to a Plan N, or they might let you downgrade your coverage from a Plan G to a Plan N or a high-deductible G, but these birthday rules, they often do not give you the opportunity to upgrade your coverage from a high-deductible G to a Plan N or that traditional Plan G. This is why, for our example projections, we will assume that you're not changing Medigap plans over time. The first key factor that must be considered for long-term cost is the average premium increases of these different Medigap plan letters. Based on our analysis comparing the nationwide average premium increases of dozens of Medigap companies over the years, we have seen that Plan G has increased approximately 6.5% per year, with Plan N experiencing slightly lower average increases of 4.5% per year. Now, to double check our numbers and our biases, we did look at Telos Actuarial Israel, who reported an average increase to Plan G of 7.1% over the past 4 years and an average of 5.5% over the same period for Plan N. Now, Telos did not report the average increases for the high-deductible Plan G, but based on the averages that we have seen since 2020 in 5 different states that we looked at, the average high-deductible Plan G premium increase seems to be about 2.5% per year. Just keep in mind that these averages, they are far from set in stone. They are only for illustrative purposes. Although we will use these averages for our examples, if you enroll in one of these Medigap plans, your premium increases will certainly be different. Overall, it should not be surprising that the average increases are lower with the high-deductible Plan G, since as we said earlier in the video, you would have to have over $13,000 in Part B Medicare approved costs before your insurance company would even have to start paying for anything. This helps keep both loss ratios and premium increases relatively low over time. In addition to premium increases, we must also consider how deductibles might change over time. Using historical data, we can try to project the future increases in the high deductible amounts. Over the past 15 years, the deductible limit has risen at an average annual rate of approximately 2.45%. Not only does the high deductible Plan G limit change, but so does the regular Medicare Part B deductible. Using the projected increases published in the 2024 Medicare Board of Trustees report, we see that they project an annual rate increase to the Part B deductible of approximately 6.36%. We will use that for our projections. You can also see here what they project for the Part A deductible increases over time on the report. Just know these are, of course, not set in stone. The long-term cost projections that we will show involve looking at the possible cumulative out-of-pocket cost for Plan N, Plan G, and the high-deductible Plan G. This means that each year's costs will add to the previous years. So if you spend $1,000 in year 1 and then $1,100 in year 2, we would then show in year 2 on the chart $2,100 in cumulative cost. Just keep that in mind. We will assume those with the traditional Plan G will pay their full Part B deductible every year, and we will project the premium increases using both the 6.5% from our calculations and the 7.1% from Telos Actuarial. First, using Michigan as our example, here are the cost projections from age 65 to age 90 for someone with the traditional Plan G and the different average premium increases. Now for Plan N, we will also assume that plan members pay the full Part B deductible each year, as well as an additional $210 in copays per year, which is the same as what we did in our Plan G versus Plan N video. Due to how uncommon they are, we will not factor in possible Part B excess charges into these projections. And lastly, we will project Plan N premium increases using the 4.5% average increase from our numbers and the 5.55% increase from Telos. When adding these cost projections for Plan N, you can see here on the chart how they might compare to Plan G. Finally, for the high deductible Plan G, we will run through a couple different scenarios due to its variable out-of-pocket costs. Each scenario will also assume a 2.5% yearly premium increase. First, we will do projections assuming that you would pay the full high deductible amount every year, just to represent a worst case scenario. Here on the screen, you can see the cost projections for this so-called worst case scenario and how that might compare to a Plan N or Plan G. However, since we don't actually expect you to pay the full high deductible amount every single year, we will show other projections assuming that you spend the average amount out of pocket for someone with original Medicare. According to a report from AARP analyzing 2018 data, the average Medicare beneficiary age 65 or older paid $1,632 out of pocket for Medicare covered services in the year. Now this number, it is likely higher now due to medical inflation, but we could not find any more recent sources or studies, so this is the number that we will use. Essentially, we will assume each year that you pay your high deductible Plan G premiums as well as the $1,632 out of pocket, and then doing this, you can see how these projections might compare to the other ones that we have already shown. Last but not least is an example of someone who is quote-unquote healthy when they first enroll in the high deductible Plan G, meaning that in this case they would only pay the smaller Part B deductible every year. And we would project this for several years. Then, for the next several years after that, we would consider that this person becomes somebody that is average in health. So in that case, they would be spending the $1,632 out of pocket. And finally, from age 83 to 90, we'll assume their health worsens, and then they have to pay the full high deductible amount each year. After showing all of these different projections on the graph, unsurprisingly, the person paying the full high deductible amount spends the most out of pocket over time. But as they do get closer to age 90, they aren't too far off from the different Plan G projections. Also, both the Plan N projections are relatively close to the high deductible Plan G projections for someone with average health and for someone with worsening health over time. If we run these same projections for somebody with the different premium amounts from Texas this time, we see that the results, they are pretty remarkably similar to the ones we just showed in Michigan, with the Plan G projections over time being closer to somebody with the high deductible Plan G paying that full deductible amount. And the Plan N projections, they are closer to someone with average health who enrolls in the high deductible Plan G. Lastly, for these cumulative cost projection examples, when we look at the potential out-of-pocket cost over time for somebody in Florida instead, we see something pretty different compared to the other two states. There, we see that even someone paying the full high deductible amount every year might still save on overall cumulative cost after roughly the first 13-year period being on the plan, and almost certainly after a 25-year period. Now, the Plan N projections in Florida, they still seem to beat out the high deductible Plan G projections, but they are a bit higher compared to the projections for those with average health and a high deductible G. Overall, for anybody watching this video or who has seen our previous videos, I think it's pretty fair to say that when it comes to comparing Medigap plans, we're pretty analytical, and that might even be an understatement.
My head hurts.
However, we will also be the first to admit that you should never make a decision about which plan is right for you based on these projections. In reality, life cannot be plotted cleanly on a graph, and our health can change at any moment. We have had conversations with far too many clients who anticipate being healthy only to have their situations change shortly thereafter. Make sure to always think about the maximum risk that you are comfortable with when it comes to any of these Medigap plans, since at the end of the day, these are insurance plans, and insurance is for the unexpected. Now, you may have noticed that we skipped over New York in these long-term projections, and not anymore. New York, it simply doesn't fit cleanly on a graph of these long-term costs, since, as you may already know, it allows for year-round open enrollment for Medigap plans, regardless of your health and pre-existing conditions. This is not the same as a birthday rule or an anniversary rule. Instead, you can essentially enroll in the Medigap plan of your choice year-round without being denied. In New York and a small handful of states like it, instead of worrying about long-term costs, you could simply directly compare the premiums and the out-of-pocket costs for the different Medigap plan options and enroll in the one that makes the most sense for you at the time. For example, if a high-deductible Plan G is $64 per month compared to a Plan G at $278 per month, it almost certainly makes financial sense to go with that plan compared to the Plan G. Then, if your health takes a turn for the worse and you do expect to pay more out of pocket for the high deductible Plan G than for the Plan G or even Plan N premiums, you can apply for the Plan G or the Plan N at that time and make the switch shortly thereafter. The reason we wanted to highlight this unique Medigap enrollment opportunity is to again address the fact that where you live will drastically impact which Medigap option makes sense for you. So as always, please make sure to avoid specific advice on plans unless you're talking to an independent broker about your situation and they are actually familiar with the Medigap market in the state you live in. Someone living in Florida or New York will have drastically different Medigap options compared to somebody living in Texas and Michigan. Last but not least, while we are on the topic of discussing numbers, we have to address the elephant in the room.
Okay, time to discuss elephant in room.
This is the fact that if we enroll you in a high deductible Plan G as an independent broker, we receive a much smaller commission compared to the regular Plan G or Plan N. Typically for Medigap plans, we are paid a commission based on the premiums that you pay for the plan. This is paid to us by the insurance company and thankfully not from your pocket. For example, as you can see here from this Medigap company, you can see on the screen in Michigan that our commission is 29% of your Plan G or High-Deductible Plan G premiums and 34% of your Plan N premiums for the first 3 years that you're enrolled in that plan. Then we get 4.5% each year after that. On this graph, you can see just how drastically our commissions would be from a Plan G to a High-Deductible G to a Plan N from this company. This shouldn't be surprising since we already mentioned that the High-Deductible Plan G often has monthly premiums of about 1/3 of the regular Plan G, and our commissions clearly reflect that. Here on the screen are some other graphs comparing commissions for these plans in Texas and Florida, just for added comparison. Now, we don't expect you to care about our commissions, but we want to bring this up because despite always trying to do our best to eliminate any bias we have, I think it is also naive to say that the lower commissions from the High-Deductible Plan G don't at least have some impact on how often these plans are recommended by all brokers. With that being said, the commissions are not the only reason the High-Deductible Plan G is not more widely recommended. Let's briefly go over some of the pros and cons of the High-Deductible Plan G before we give our final thoughts on whether it might be right for you. One of the most compelling advantages of the High-Deductible Plan G is that it has significantly lower premiums compared to the traditional Plan G or Plan N. Not only does the High-Deductible Plan G come with those lower premiums than the other Medigap plan letters, but the premiums they also tend to increase at a much slower pace compared to the Plan N or the Plan G. The High-Deductible Plan G provides a low premium option that still gives you the freedom to avoid networks and see providers nationwide who accept original Medicare, and it makes it extremely rare that you would need prior authorization before you have a procedure, since Medicare is still your primary coverage, unlike if you were to enroll in a Medicare Advantage plan. Lastly, if you are healthy and remain healthy for the foreseeable future, you will almost certainly save overall compared to the Plan G or the Plan N. The High-Deductible Plan G may also be a good option for those of you who have accumulated a decent amount of funds in a health savings account to use for future medical expenses in retirement, or for those of you who simply have enough savings to pay the full deductible amount without issue. However, there are also important cons to consider. The primary drawback of the High-Deductible Plan G is probably not surprising, but it is the higher out-of-pocket costs that you might face if your health worsens or if you have unexpected medical expenses. As we have already mentioned, it is impossible to know when your health will require you to actually need more medical care on a regular basis. These potential out-of-pocket costs, they also make budgeting with a High-Deductible Plan G much more difficult, which can be extremely important while on a fixed income. In addition to being more difficult to budget, it will simply be more difficult to keep track of bills and how much you owe providers. Remember, for most services, you will be paying 20% of the cost, which makes it difficult to know what you will be responsible for paying for a procedure until after it's actually completed. Sure, you could try to use the online tool that Medicare has to look up specific procedures, but these will vary based on where you live, and you will simply never know all of the codes and procedures a provider is planning on doing beforehand. Now, the last two cons that we typically associate with the High-Deductible Plan G, they are more psychological than financial. But we simply often hear from our clients who do enroll in the High-Deductible Plan G that they feel their insurance isn't providing any coverage, and in reality, they're right. Unless you're paying enough out of pocket to reach the full yearly high-deductible amount, your High-Deductible Plan G, in fact, is not paying anything. Also, the amount you pay towards your deductible, it does reset every January 1st, which can be disheartening for some if you get close to meeting the deductible at the end of the year, only for it to restart again from zero. Now, in reality, these are positives since it means you're relatively healthy and likely saving money by not paying that much out of pocket. But again, this can be hard for people psychologically when some of your friends with Medicare Advantage are bragging about $0 monthly premiums and extra benefits, and while your other friends with the Plan G or the Plan N are paying higher monthly premiums, but they have much lower out-of-pocket costs when they actually need medical care. Now it's time to wrap things up with our thoughts about the High-Deductible Plan G. Frankly, for the majority of consumers, we still don't recommend the high-deductible Plan G as a clear go-to option. But that does not mean it is not the right option for the right person. Overall enrollment trends also seem to back this up. According to MedicareSupp.org, in the first 6 months of 2022, approximately 38% of Medigap enrollees chose Plan N, with 51% choosing Plan G and only 6% with the high-deductible Plan G. In terms of client preferences, we often find that reactions to the high-deductible Plan G are mixed. Some clients, they appreciate the lower premiums and they're willing to take on the higher deductible, while other clients are wary of the potential for higher out-of-pocket costs, and they would much rather have the predictability of the regular Plan G or possibly the Plan N. Perhaps even more commonly, we see that those who are interested in the high-deductible Plan G might prefer the Plan N, which still provides premium savings compared to the Plan G, but with lower potential out-of-pocket cost compared to the high-deductible G. Finally, others that want to save as much as possible on premiums, they might rather enroll in a zero-premium Medicare Advantage plan and deal with the potential drawbacks that it comes with. However, we will say if you hate the idea of any additional coverage aside from original Medicare and you don't think that you will need a lot of medical services, then we would always recommend at least enrolling in the high-deductible Plan G instead of having nothing but original Medicare. For the low monthly premiums with the high-deductible Plan G, you can still protect yourself from the unlimited 20% cost you would have with just original Medicare Parts A and Part B. If you're interested in a high-deductible Plan G, but you feel you don't want to fully commit to it long-term, just know some Medigap companies in some states provide the unique opportunity to convert from a high-deductible Plan G to a regular Plan G after a couple of years without having to answer health questions. So make sure to ask if they are available in your state when you talk to a broker. Ultimately, the choice between these plans should be based on a thorough evaluation of your current health status, financial situation, and your comfort level with potential out-of-pocket costs. We encourage you to discuss your options with an experienced broker who can help you navigate these choices to find the plan that fits your needs. If you found this video interesting, we know you will love our Plan G versus Plan N video, so please make sure to watch that one after this one.